Well, we know a lot about patient safety that we didn't know 10 or 15 years ago. 10 or 15 years ago, we thought medical errors occurred because people were bad. Doctors were bad, careless, nurses were bad and careless. We now understand that most errors are committed by good people trying to do their best, and they happen because the systems don't work very well.
Améliorer le système de soins dans sa globalité, favoriser une meilleure prévention et un contrôle de l'infection plus efficace, autant de réflexions et d'actions menées partout dans le monde, dans les pays développés comme dans les pays les plus pauvres. Ces réflexions et ces actions étaient au cœur des échanges et des débats d'ICPIC, la conférence internationale pour la prévention et le contrôle de l'infection. Une conférence qui se déroulait pour la seconde fois ici à Genève, l'occasion de rappeler que ces préoccupations de tous les jours en faveur du contrôle de l'infection sont apparues dans les années 70 aux États-Unis grâce à une étude menée pour vérifier l'utilité d'un tel contrôle.
5 years of data collection and 10 years of studying, and the answer came out showing that infection surveillance and control programs are extremely successful when implemented vigorously, have a great impact on the nosocomial infection rate, reduce length of stay of patients, save a great deal of money for hospitals, and prevent many patients from crippling or even fatal infections. So it turned out to be an astounding result that has had implications ever since then. In fact, the entire implementation of infection control in the world has really been stemmed from that study.
40 ans plus tard, de nombreuses initiatives ont vu le jour à travers le monde et témoignent de la nécessaire mise en place du contrôle et de la prévention de l'infection dans les établissements de soins.
In 2009, we started the National Hand Hygiene Initiative with the plan that all hospitals, public hospitals and then private hospitals also should submit data on their compliance 3 times a year. And gradually that has got bigger and bigger. And so now that we have over 680 hospitals 3 times a year submitting data, and it goes through a validation process and then is now put on a government website so that all patients in Australia can look up their hospital and see what the hand hygiene compliance rate is.
Aujourd'hui, les hôpitaux, les cliniques, le monde médical dans son ensemble se sont adaptés et s'adaptent encore au quotidien pour le bénéfice des patients mais aussi des équipes soignantes. Symbole également de cette prise de conscience, les spécialités paramédicales qui se sont elles aussi engagées dans ce processus, ainsi que les médecines traditionnelles comme la médecine chinoise.
I have started a pilot in the TCM clinic in Baptist Hospital. The increase in alcohol hand rub is significant. It's already increased by 10 times. And by observation, their hand hygiene compliance increased from 20% to 80%. So it's a good start, but this needs to be expanded to other clinics, hopefully throughout Hong Kong, then China, and then to the rest of the world.
Créé en 2011 à l'initiative des hôpitaux universitaires de Genève, ICPIC aura démontré la nécessité de la prévention et du contrôle de l'infection partout dans les établissements de soins. Mais ce rendez-vous d'experts, de gens de terrain, de décideurs est aussi le témoignage de l'élan qui existe et se propage sur tous les continents pour aller encore plus loin, pour innover, pour inventer et réinventer les bonnes pratiques médicales de demain.
You know, previously we were just looking at campaigns and seeing people doing it, but this time around we're seeing lots and lots of innovative ideas from various parts of the world, you know, ranging from patient participation, staff participation, and even tapping on interesting technologies and gadgets.
I think that we've made great advances in recent years in terms of preventing healthcare associated infections, mainly by improving adherence to the things that we've known have worked for years. We're just getting better at implementing them more consistently in the hospital. But there's still a role for innovation and new learnings and new techniques.
Innovation is everywhere. We have an innovation academy, an implementation academy, and the projects that were presented are absolutely unique. So this is great to see that we are on the top of innovation for hand hygiene, but also we are on the top of very simple actions in district hospitals in Africa, in Indonesia, in very remote places, very simple places where action works and infections are reduced and we are saving life. So between innovation and implementation everywhere. It's a great satisfaction for all of us, including the team that worked so hard around me to make it possible.